The FDA and HHS are backing a new effort to officially reclassify marijuana as a less addictive drug. So right now, cannabis is considered a Schedule I substance that is the most addictive. It's the same category as heroin. But a new FDA review recommends a Schedule III classification for marijuana, much less addictive. That group includes testosterone and ketamine. Well, some doctors are concerned about reclassification, saying not so fast. A study published in the Lancet Psychiatry found daily cannabis users were nearly 5 times more likely to develop a psychotic disorder. Joining us now for more perspective is child and adolescent psychiatrist Dr. David Schrieber. It's good to see you, doctor. Thanks so much for being here.
Thank you, Natasha, for having me here.
First of all, let's start with the recent data showing a link between marijuana and psychosis. How serious is this? What do we need to know?
Well, let me start with some validating information on a national level as well as a local level. On a national level, it's important to recognize that there have been lots of studies since 2019 where we are evaluating emergency rooms. And emergency rooms talking about the increase of close to 50% more adverse reactions as a result of cannabis. On a local level, at Compass Health Center, we feel like we have a real good pulse of the mental health of our community. And we have 54 programs across our online and on-site models and across Maryland and Illinois. And as a result, we really understand what's going on in the community. And we've seen a real significant spike in those people who are utilizing our co-occurring mental illness and substance use programs.
I appreciate that context, and I'm glad you're bringing up the data about emergency room visits. I found that really surprising. And we know that data from the DEA shows that the amount of THC in cannabis products has increased significantly in the past 3 decades. What risks are associated with this sort of high-potency marijuana, and do you think that is what is behind the emergency room visits we're seeing?
So it's a great question. Whenever we see spikes in mental illness, it didn't happen overnight, and there's multiple reasons, and I'll give you a few of those. One is accessibility. In 2019, legalization of recreational use was happening in 11 states. In 2024, we have 24 states, and we're anticipating that to increase to 29 states. So accessibility has increased significantly. To your point about potency, also seeing what potency is happening is that, to your point, today's marijuana is different than yesterday's marijuana. On average, decades ago, we were seeing concentrations about 4% of THC potency in marijuana. Today, we're seeing close to 20%. We're seeing products out there being marketed for 90%. So we know that there are a lot of studies out there that correlate adverse reactions to potency of cannabis.
Specifically, when it comes to the risk of psychosis, why young adults? What is it about the young adult, the developing brain, and also other risk factors that young Americans are facing today?
So it's a very important question to kind of recognize, and I come here as a doctor and as a parent, is that one of the things I talk about as a doctor is the importance of the 3 E's. The importance of educating, engaging, and enrolling. And the importance here is that we need to learn the facts. We need to spread the facts about educating what is out there, what the risk benefits are. At the same time, is once we know those facts, that we could engage in our children in educating about what are the risks and benefits so they make better decisions about their use and the behaviors they engage with. At the same time, us as parents, we know our children the best. And when we know our children best, we have to recognize when we see their behaviors are deviating, it's important to enroll, not disregard, not deny, not just hope that they get better, but enroll them in care and trusted organizations like Compass Health Center or other trusted organizations that are out there.
All right, Dr. Schrieber, I appreciate your time. Thank you so much.
Thank you so much, Natasha, for having me here.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.